Good afternoon, Mary. I'm Elizabeth McEntyre. I'm a Warramai Wanneroo woman from New South Wales.
Thank you very much. Now, let's just go.
Yeah, I'm Sonia Schuh and I'm from Napranum on the Western Cape. That's
Thank
me.
you, Sonia.
Hi, and I'm Diana. You've probably got me from the letter. So I'm Diana Jans, and I live here in Cairns, and I'm a social worker, teacher by trade. My family connections are Wanyi in the Gulf, and Thepitigi and Chunginji in Mapoon, just north of Weipa.
Thank you very much. Now, we'll just go back to Elizabeth. You can describe, you're all members of the...
We're all members of the college's Aboriginal and Torres Strait Islander Mental Health Committee.
And what do you do?
Well, we're community members. We're representing community, but we're there as, as an advisory group to the college in regards to how they're working with Aboriginal and Torres Strait Islander people and communities. Yeah, and what we can do to support them in doing so.
And what are those main issues?
Well, mental health and well-being is a huge one. We're concentrating on things like suicide, what else? Forensic, certainly within the criminal justice system, adolescent and youth, and elders, and also our senior people.
So you've come here for the 4-day conference. What are you wanting to hear here? And what would you like them to hear?
Well, I've just sat on a fantastic session around visions and around hearing things, and it was our New Zealand partners. Tukoni Hira is our New Zealand committee, and they've just presented on that about the differences in what we perceive as spiritual experiences and things like that to what white people would see, So that was a great... Yes. Were you in that session? Yes, I thought I saw you walk out. So there were 3 sessions, and one was from a Sri Lankan worldview, and one was from a Buddhist perspective as well. So that's about culture, that's about diversity, and that's about things that the college has to take on, because they don't all just work with non-Aboriginal people or non-Indigenous people.
And we know that there are very few psychiatrists in remote areas, and we had a big presentation from Professor Ernest Hunter today about remote communities. What do you think psychiatry as a profession really needs to do to be able to really understand Aboriginal and Torres Strait Islander mental health?
They have to, stop thinking that what they know is the best way, and to look at our knowledge as well. And it's about blending those knowledge systems, and that's what I believe. So I'm here to learn as much from what psychiatrists know and what I know as well.
Fantastic. Thank you, Elizabeth. Now I'll just go to Sonia. Sonia, what's your role with the committee? What's your background?
Well, my background, I'm a teacher by trade. I taught in the Napranum community, and I was invited to come and sit on the committee. And I think the reason why I said yes was I wanted to know what is out there for our young people that are going through some mental health issues and struggling with their own thoughts and ideas and feelings. And I wanted to see what's out there, because suicide has touched our community and has touched me personally. And I want to see how all this fits in and how it manifests back into community after all the bigwigs talk and all the policy makers and all the decision makers. After all this, what comes out of it, and how does it manifest in the community to help our young people?
So your message is to what is psychiatry actually doing on the ground in these communities? What can it bring?
I think it can bring a way of helping our people understand what they're going through, and that there is help out there. What kind of help, I don't know yet, but there are people out there willing to help. They just need to know how they're going to help us, and I guess take advice from the people that have been helping for generations and generations. So the way we need help is a little different to what everyone else thinks what we need, you know. So I think what I'd like to see out of it is a lot more Aboriginal and Torres Strait Islander ways of knowing and doing being brought into the healing process.
Thank you very much, Sonia. Now going over to Diana. What are you hoping to hear here, and hoping that the psychiatric profession gets to hear?
Okay, from myself, what I want them to hear is the massive inappropriateness of our healthcare systems, our social emotional well-being that's not happening in our communities. I also want this forum to be about knowledge-based for the professionals here, to know that it's not, you can't just deliver a service without having trauma-based knowledge, without having historical knowledge, and about being aware of the environment. So knowing that it's a 12-hour drive from one place to another place, and then you can't get there at certain times of the year. I want people to understand how difficult it is to live in a remote Indigenous community, whether it be in Cape York, whether it be Outback Alice, Torres Strait. I want people here to know that it's not a simple one fixed solution. You can't just have a psychiatrist in a community and it's going to change, because it's going to take multiple years to make a change, and it's also going to take a lot of understanding, sensitivity, and working with community, because they're the people who know best.
Thank you very much. Would anybody like to say anything more?
I guess we talked a lot about in our meeting yesterday, Maria, around advocacy and about being those disruptors, disrupting the status quo, because what's going on now isn't really working, despite we're up to our 5th National Mental Health Plan. So many plans and policies in place just haven't worked. So it's around disrupting that status quo so that it works for our communities.
And is being on the committee, what does that bring for you, and do you feel it brings power to communities?
I think for such a huge organisation as what the college is, I think there's over 6,000 psychiatrists within this college, for us to be able to have a voice for not only ourselves but our communities. That's why I put my hand up, so that we were at the table, influencing. And bringing the solutions, not just having a whinge about it, not just putting the boot in, but bringing the solutions.
Yeah. What would you take away as one key solution?
We have the answers. We've got them. But we want to work with you to implement them.
Thank you very much.
Thank you.